thank you for joining us today. Our topic is on our project, Engaging Youth Stakeholders in Youth Vaping Harm Reduction. My name is Julia Hartley. I'm the PEI Director of Operations for our Charlottetown office. And I'm going to turn it over to Jen to introduce herself and to do a land acknowledgement.
So I'm Jennifer O'Brien. I'm the Youth Vaping Coalition Coordinator, and we'll share a little bit more about our coalition towards the end of the webinar. So in the spirit of reconciliation, we acknowledge that the land upon which we gather is unceded Mi'kmaq territory. Epigwet in Prince Edward Island, Mi'kma'ki, is covered by the historic treaties of peace and friendship. We pay respects to the indigenous Mi'kmaq people who have occupied this island for over 12,000 years. Past, present, and future. So a little bit about who we are. I'm sure most of you are familiar with us, but just in case, Lung NSPEI is the leading lung health charity in Atlantic Canada. We are a charitable health organization dedicated to improving quality of life by preventing and managing lung disease through advocacy, patient services, education, and research. For most of us, breathing is so natural that we don't even think about it. For the 1 in 5 Nova Scotians and Islanders who struggle with lung disease, it can only be their only thought. They know that when you can't breathe, nothing else matters. Lung NSPEI continues our ongoing advocacy and projects based on initiatives to strengthen prevention efforts and support Islanders on their quit journey. Tobacco and vaping reduction programming that we do include Youth Vaping Awareness Days presentations. These happen annually since 2021. We have them in PEI, and Nova Scotia is just starting to do them just very recently. Exploring Youth Vaping and Smoking Prevention and Cessation on PEI project happened in 2022. Community Advised Smoking Cessation project was 2022 to 2023. And we did the Engaging Youth Stakeholders project this year, which is the topic of this webinar. This project could not have been possible without support from the PEI Alliance for Mental Wellbeing. The project aims to share research finding on youth vaping and smoking cessation and prevention, and ultimately seeks to strengthen advocacy efforts for policy change and foster partnerships to support youth in PEI to live a nicotine-free lifestyle. Vaping products have now surpassed tobacco and the most common nicotine-containing products used by Canadian youth. The latest Canadian Student Tobacco, Drug and Alcohol Survey found that 20% of PEI students in grades 7 to 12 had used e-cigarettes in the last 30 days. The findings are down from 27% from the previous survey and getting closer to the national average, which is about 17%. And these are the results of the latest Compass survey. The purpose of this survey is to evaluate how changes in programs and policies that students are exposed to are related to changes in youth risk factors and health outcomes. This survey is done in 5 Canadian provinces. And as we can see, the increase in vaping use is drastically increases between 9th and 10th grade on PEI. And that's because the junior high is grade 7 to 9 and high school is grade 10 to 12. According to a 2020 CDC survey, youth in PEI are beginning to vape between 15 and 16 years old. Some motivations for youth to start vaping include ease of accessibility and flavors, as there are more than 16,000 flavors available on the market, social norms, and stress reduction. And to look a little bit further into the statistics there, the Compass survey also showed us that 44% of students used vaping to relax or relieve stress or anxiety. 38% have used vaping because they were curious or wanted to try something new. And only 4% have used vaping as a way to quit smoking. And this image here demonstrates the wide variety of vapes that are available and just how easily they are to conceal because they are not easily recognizable. And all of these vapes in the photo have been confiscated from schools.
So now we're going to talk more about the specific projects. And I wanted to introduce our engaging youth stakeholders by talking about some of the background on how we got to this point. So in 2022, Lung and SPI conducted the Exploring Youth Vaping Smoking Cessation and Prevention project that was also funded by the Alliance for Mental Wellbeing. And our aim was really to increase the knowledge of the gaps and opportunities on PEI around nicotine prevention and cessation programs for youth, and specifically we were looking at those aged 11 to 21. This project consisted of a series of interviews and a survey with youth who had either quit vaping or were currently vaping. We also did an asset map of both health and community sectors, was conducted to capture programs and services on PEI that could potentially help youth quit smoking or vaping, as well as manage stress and anxiety. And finally, we conducted a literature review on evidence-informed youth prevention and cessation interventions with a specific focus on PEI. From these findings, we identified 4 evidence-based recommendations. So these recommendations included expansion of the PEI smoking cessation program to include more counseling targeted specifically at youth, utilizing existing mental health programs and services targeted to support youth to manage stress and anxiety using healthy lifestyle behaviors. Our third recommendation was screening youth for use of vaping products starting at age 12 using evidence-based screening tools. And finally, our fourth recommendation was to continue to advance nicotine reduction policy measures focused on youth protection. So this report is available on the Lung and SPEI website. We can also send it out when we send out the recording if anyone's interested. So following our Exploring Youth Vaping report, we didn't want these findings to just sit on the shelf. We wanted to reach the community with them. So the next phase of our project was focused on knowledge dissemination, with our target audiences being both youth as well as frontline staff who work directly with youth, such as healthcare providers, youth workers, as well as those roles that influence youth, such as health charities and government. So our findings from the Exploring Youth Vaping asset map, we took those findings from our asset map and put together a list of community partners who were identified. We also brought on leading impact consulting to help with the workshop planning, facilitation, and evaluation. And again, we received support through the PEI Alliance for Mental Wellbeing. So our project consisted of 3 key outputs, the first being a short educational video that explained the connection between nicotine addiction and toxic stress buildup. Our second output was a series of communication materials that highlight the stories of island youth. And the third was a series of workshops targeted at youth stakeholders to disseminate knowledge and receive feedback on the 4 Exploring Youth Vaping project recommendations I just went over. So for the educational video, we contracted animation company Cartoon Conrad out of Halifax. The animation video helps to dispel the common misconception related to vaping and tobacco products being a stress reliever and highlights how nicotine products can alter brain chemistry, in turn creating nicotine dependence that increases feelings of stress and anxiety. We really tried to break down these complex concepts into a way that would easily digestible for those in our target audience. So we brought on a team of 5 island youth volunteers who were between the ages of 13 and 17 to plan and develop the script for this 4-minute video. The youth team was provided with a 1-page overview of the evidence around mental health and youth vaping to build the script from. Over the course of several meetings, they finalized a script. We even had one youth who actually sketched the characters for us that were given to Cartoon Conrad, who is now actually at Holland College doing animation, so that's pretty neat little connection. And our youth continued to be involved over the summer to review youth video drafts and provide feedback, and they were compensated for their time. I'm now going to play a short video clip from the 4-minute video. Following this webinar, we will send out with the recording a link to this entire video so that you can view it.
You want a hit of my vape?
No, I'm good, but thanks.
Are you sure?
Yeah, I'm okay.
Come on, it's not gonna hurt you. Just try it.
Actually, yeah, sure.
Many youth begin to vape due to peer pressure. Alyssa's idea that vaping is harmless is not true. Vaping is harmful to our bodies and brains. It has been shown that vaping can affect a person's ability to concentrate, learn, and make decisions. Since vaping is fairly new, only being created in 2003, these are only the short-term effects that we're seeing.
Great, so that was just a short clip. Our second knowledge dissemination strategy was a series of interviews that we conducted with youth aged 18 to 24 who had either quit vaping or were currently vaping. Youth feedback from both our Exploring Youth Vaping project and our Youth Vaping Awareness Days evaluation identified storytelling as a really important strategy for knowledge dissemination. So we're now going to play a short clip from one of our videos. Both the animation video and our youth testimonials were shared on our social media channels and incorporated into our Youth Vaping Awareness Day video for grade 7 students.
I'd say the only reason I started vaping was the influence of other people. People around me who were vaping, and it was considered cool to vape, so I definitely think that it was influenced by everybody else around me. Vaping is what started vaping for me. I find that vaping has affected my mental health in the way that I would be freaking out without it, and it was something so meaningless, yet I felt like I couldn't go without it, and I would freak out if I didn't have my vape. It would also dampen my mood if I couldn't get a vape rip, and if I couldn't afford it, I would be angry, and then it just brought my self-confidence down because I felt like it was an addiction that I wanted to hide, and it really brought my self-confidence down.
Great. So we did a series of these interviews, and I have to say that I think that as you can see from this youth, it is really powerful to hear directly from them, and we've had a really good response in our Youth Vaping Awareness Day video by incorporating these videos. So our third output, which I'm going to spend a bit more time on, is really about our series of 11 workshops. So our aim with these workshops was to disseminate knowledge on and facilitate discussion on vaping reduction and PEI and work towards building partnerships. So we wanted to, increase confidence and understanding among frontline youth workers on best practices approaches, and really just have a better understanding of what people were seeing out there and how we could better learn more about PEI. So between November 2023 and May 2024, we hosted 11 workshops, reaching over 220 participants who represented over 20 organizations. And thanks those who are on the call today for attending our workshops. We really appreciate it. In addition to knowledge dissemination, participating organizations had the opportunity to share experiences and provide feedback on our 4 proposed recommendations. Some of the sessions were hosted for a particular group, larger groups such as PEI Dental Association, Hygienist Association, whereas other sessions were attended by representatives from different organizations. And as you can see on this slide, here's a list of some of the organizations that we worked with, many nonprofits, many who work frontline with youth in addition to the health sector. So it was really a big mix of organizations. So I'm now going to share some of the examples of the content that we included in our Engaging Youth Stakeholders workshops. The sessions were between an hour and an hour and a half, depending on the size of the group. So first, participants learned about mental health and addiction connections and gained knowledge on how nicotine affects mental health. With evidence showing that many youth start vaping to lessen feelings of stress, anxiety, and depression, our workshops aimed at creating a better understanding of how adult influencers, such as youth leaders, teachers, and coaches, can play a key role in supporting youth to adopt a nicotine-free lifestyle. These workshops aim to build confidence among adults who work with youth and provide opportunities to have open and honest conversations. That was really a key part of our workshops. Our workshops also aim to share local resources, such as the PEI Smoking Cessation Program. We're very fortunate in Prince Edward Island to be one of the few provinces that offer a very comprehensive nicotine cessation program, and vaping was added to this program a couple years ago, so we're very proud of it. So our initiative aimed to support opportunities for responsive relationships between youth and adults to help them stay nicotine free. And in turn, we hope that youth will hear accurate information and get support for their quitting journey, or just maybe are curious and want to know more. So we really hope that the adults took away more accurate information that they could then pass on to youth. So in addition to knowledge dissemination, participating organizations had the opportunity to share their experiences and provide feedback on our 4 proposed recommendations, and I'm going to get to the findings in a second. And the second half of the workshop, we included an activity where participants actually got to brainstorm ideas related to the 4 recommendations in small groups. At the end of the session, participants each received 10 dot stickers where they got to vote on the ideas that they thought were the most important. And as you can see from this slide, something that came up a lot was, including screening and more information around ZINs and Zonics was highlighted as being very important for participants. So you can see that, often one idea really gained a lot of value in that group. So I'm now going to provide the general themes that came from our findings from this activity. We will have a report up on our website, but it won't be available probably till the beginning of the new year. So for our first recommendation was the expansion of the PEI Smoking Cessation Program to include vaping, which actually was achieved since we put out this report. And then, so we just changed it a little bit to say, and counseling support specifically targeted at youth. So some of the themes that came up around this recommendation was reconciliation with PEI First Nations communities, having the program be more focused on specific strategies for youth, whether that be tech support or having specific counseling groups that were only intended by youth, a variety of programs and services, a variety of locations across Prince Edward Island for those outside of Charlottetown, expanding coverage for nicotine replacement therapies. So we do have a pretty comprehensive program at 12 weeks, but for certain individuals, more might be required or intake more than once during the year. Parent engagement on this topic, further integration with the schools and curriculum, sharing knowledge and lived experience, additional capacity, and expand referral pathways and community partnerships. And we're really happy to hear that this program has been extended to the pharmacies. So I feel that is a great step in the right direction. Our second recommendation was utilizing existing mental health programs and services targeted to support youth to manage stress and anxiety using healthy lifestyle behaviors. So some of the main themes that came up around this topic were, better identifying programs and services in the community. So there may be programs that exist, and maybe there's just a lack of knowledge of these programs among frontline providers. Also, decreasing barriers to access, especially in a rural province like PEI, the access can be an issue. More advocacy needed for continued or expanded funding for these programs. More outreach opportunities and advertising. Also, what came up a lot was, programs that are focused on other stressors for youth, such as screen addiction and healthy online behaviors. We also heard that more follow-up services were needed around mental health. And some participants were looking for a jurisdictional scan of programs and services, and they thought that would be helpful. Our third recommendation was screening youth for use of vaping products starting at age 12 using evidence-based screening tools. So currently screening is done very comprehensively at the acute centers, such as hospitals and in some primary care clinics. Screening could be expanded to public health, dentists, dental programs, optometrists, pharmacies, student well-being teams, school vaccines, etc. Those are some of the topics that came up in youth groups. Some considerations that came up were, parents being present and how that can impact youth answering the questions. We heard from some folks in the health professions that said, often they'll kind of wait for the parent to leave the room to ask some questions. So it was nice to hear that some of that work is already being done. Also, some considerations around consent processes and data collection and storage. Obviously, privacy is a huge factor here. And finally, our fourth recommendation was to continue to advance nicotine reduction policy measures focused on youth protection. And some of the themes that came up from this recommendation were increased funding and access for mental health supports and programs, more legislative and regulatory changes for vaping sales and use. We're hoping that this will come to the legislature this fall. I know that there is a bill that may be tabled, so glad to hear that. Increased enforcement of current regulations, regulating the sale of nicotine pouches. Also, since this project was done at the federal level, there is some work there. Additional school supports and policies, and youth involvement in policy development. So all participants also received a take-home package of resources that included content from our Chief Public Health Office, Live Well Division on the smoking cessation program, as well as just facts on vaping generally, as well as some of the resources around our Youth Vaping Awareness Day program in Prince Edward Island. So overall, our evaluation showed that participants felt like they benefited from the sessions. Close to 95% of respondents either agreed or strongly agreed that the information presented during the workshop was relevant to their work or the work of their organizations. Almost 80% of respondents either agreed or strongly agreed that the presentation increased their understanding of the health risks involved with youth vaping. And almost 80% either agreed or strongly agreed that the workshop helped them feel more comfortable answering questions that youth may have about vaping. So Long N SPI believes that, building coordinated partnerships around the topic of youth vaping and smoking cessation and prevention, together we can strengthen existing advocacy efforts for evidence-informed services and work as a collective voice for improved policy change. So I'm now going to turn it over to Jen to outline the next steps for our continued work in this area.
So as I had mentioned before, we are in the process of creating a youth vaping coalition. So I was brought on to kind of oversee this coalition and help develop it. There have been reports, roundtables, and public outcry for policy changes regarding youth vaping. We decided there is a need for youth voices to lead the charge on vaping reduction and policy change. A youth vaping coalition will be comprised of 8 to 12 young leaders aged 16 to 24. The coalition aims to empower youth, build advocacy skills, create impactful tobacco reduction policies, and promote healthier futures for all. In the first year, we will identify and invite potential coalition members from diverse backgrounds, develop coalition structure as a group, develop board skills, determine the first focus of advocacy, undertake advocacy planning together, determine a budget, and do communications planning. And then finally, we'll plan for the Vaping and Tobacco Reduction Symposium that will be held in PEI fall 2025. We are currently in the first stage, which is recruitment. So we have 4 youth on board so far, and we're hoping to reach our goal numbers before the first meeting. The first meeting will take place in January 2025, and we expect to have about 6 meetings in the first year. The first meetings will include workshops to develop basic board skills, advocacy skills, and practice working together as a coalition. The coalition is fully funded for 3 years by the PEI Alliance for Mental Wellbeing. And here are just some examples of the groups that we have reached out to so far. The beauty of this model is that it's up to the coalition members to steer, with oversight from me as the Youth Vaping Coalition Coordinator. And I'll be planning meetings, events, and coordinating the initiatives that they decide upon. They will work together to shape the coalition, and they may bring input from their diverse backgrounds and experiences. Some examples of action items that the coalition could include are petitions, meetings with politicians, social media campaigns, rallies, or more. This youth coalition represents a significant step forward addressing youth vaping through collective and informed approach. By harnessing the passion and insights of young leaders, we will aim to create impactful policies that safeguard the health and well-being of youth in our communities. Adult-led organizations have the opportunity to be coalition supporters. These supporters may be called upon as information and education resource by the Youth Coalition. Supporters can provide insight on their field, however, the decision-making is done by the members of the Youth Coalition.